All right, Landon, hit the disclaimer.
Instead of giving somebody 5 different medications and making this really long skincare routine, I typically put a lot of these ingredients in one. So this one is triamcinolone, which is a gentle steroid. It's hydroquinone of 4%, which is the bleaching medication, and it's tretinoin 0.5%. So that's an example of one of the melasma medications. And then you can go into tranexamic acid, niacinamide. Niacinamide is a great antioxidant for the skin because it protects and restores almost. Niacinamide is great to put on for any and everyone with acne. It's somebody that's trying to be proactive about their skin barrier. But you can just overdo it with hydroquinone. So you have to make sure that you're taking breaks, I think is the easiest way of doing it. Bleaching and blending is kind of how they talk about it when it comes to treating it. You want to be able to pull out the pigment, but also blend the pigment that's there. And a big misconception is that people typically have splotches, unless they have that mask like I told you about. It's typically splotchy. And so people think that they should just put the bleaching medication on the darker spots. But then you just turn those spots a different color, whereas the rest of your skin is a different color as well. So you end up going from having dark spots to light spots. So when it comes to treating melasma, I typically treat the entire face. We're going to bleach and then we're blending so that it's all supposed to be one color. But it is a long-term process, and they get frustrated because they don't understand why it's worsening. And it's not necessarily that it's worsening, it's just that there was more pigment stored in this layer of the skin. So it can be really complex. Other things like microneedling, chemical peels, lasers, although lasers can sometimes worsen it. If done correctly and healed correctly, lasers can be really beneficial. Anything that's going to give them that peeling and reproductive process of the skin is going to amplify their benefits. So chemical peels can be really great. Obviously, you have to be already pre-treating on those retinoids that we talked about, but a chemical peel is going to give you a much deeper peeling, and if done the right way, it can be very beneficial. Darker skin tones have to be very careful because anything that causes peeling can worsen pigment if not done the right way and not healed the right way. If you get a chemical peel and you don't take care of it the right way, it's going to hyperpigment and it's going to look worse, and that's counterproductive. They just have to really be pre-treating, really be protecting from the sun. I almost tell them, if you're not going to avoid the triggers, do not waste your money, because it's a continuous process that you're going to be very frustrated with if you aren't avoiding what's causing this. And so I have to have that conversation before I even start treatment, because it can be frustrating. And then they're looking at me kind of like, why am I stagnant, or why am I not seeing results? And I'm like, you work outside and you don't wear a hat and you don't wear sunscreen. So you can almost, you kind of have to be direct with them on it. And so sunscreen is almost not even enough. If you work outside and you're treating melasma, you should have a hat and sunglasses and be, avoiding the sun as best you can. Working outside obviously is harder, but it's a difficult process. But I think that that's kind of the best approach, is a compounded medication, troubleshooting or alternating hydroquinone and not hydroquinone. For example, this one has the hydroquinone in it. You would give him that for 3 months, and then the following 3 months, you would just take that one out, and it would just be the other two. And then the following 3 months, you would have them put that back in. So that's why I like the compounding, because you can kind of pick and choose. But again, we carry the ZO line, and they have a whole protocol on how to treat melasma. And it is, it's a commitment. You're not treating melasma with using something inconsistently here and there.
What about pregnancy? Does it go away at the end of pregnancy?
No. Yeah, it's really difficult. If you're predisposed to it, it can lighten a little bit after pregnancy, but the unfortunate part about it is that it can be just lifelong. And if you have multiple pregnancies, then it kind of compiles. But once they're not pregnant anymore, treating it aggressively and being really proactive on it is how I would approach it. Not all of these things you can be on when you're pregnant. The good thing about ZO is they have something called Bright Alive, which you can be on while you're pregnant, and that works on pigment, and it's a little bit more gentle, but it works on brightening and on pigment. That is something you can be on. You can also be on things like azelaic acid. You can be on vitamin C. You can be on sunscreen. At bare minimum, you can be preventing with sunscreen. No, it's not going to do anything for the hormonal side of things, but the sun is, we don't realize how much sun we get. When you get in your car and you drive to work and you're in the car from 5 to 10 minutes, you're getting sun. Whether you think it or not, you're getting direct or indirect sun. Walking from your car, walking to your house, you can have anywhere between 10 minutes to hours of sun a day. And if you add that up in a week, add that up in a month or a year, you get a lot more sun than you may intend. Just daily sunscreen is really big for preventing melasma.
From the aesthetic and cosmetic side of dermatology and everything, how do you view, say a 20-year-old who's, I want to keep this face forever, compared to somebody who's 40 and is just now starting, has some signs of aging, to somebody who's 60 and is trying to undo some stuff, or maybe they've been perfect until they're 60. Do we keep anything going? And then also, do guys do any type of anti-aging things?
So aging, in a sense, in my opinion of aging, I typically am referring to the changes that are happening in the skin. So starting in your mid-20s, your skin is starting to decrease the production of collagen, elastin, hyaluronic acid. And these are the components of our skin that keep our skin tight, firm, and bouncy. And so you start decreasing in production in mid-20s. By the time you're 40, you have a massive lack of those things. And so protecting from further breakdown. And then you have things like genetics, free radicals like the sun, and smoking and alcohol and poor diet. All of those things that break down our DNA are only worsening the natural decrease in production. So in a sense, when we talk about anti-aging, I think it's multifaceted, but I think part of that is going to be avoiding those free radicals. Again, sunscreen is huge. The sun literally changes our DNA, and it is not always an instant onset. So you get sun in your 20s, you may not see the negative effects of it till you're 40 or 50, but protecting from it is still important. Avoiding smoking and alcohol, eating a well-balanced diet, exercising, all of those things that keep you healthier and protect from the free radicals are going to be considered anti-aging. Things like glutathione, things that are helping you protect from free radicals. So that's anti-aging. When it comes to the skin, it's important because we want to protect from what's breaking down our skin. We're already breaking down naturally, then you add all the extra. So things that are going to be protective are going to be antioxidants, niacinamide, like we talked about. Vitamin C is also another antioxidant. Those things are going to be really important. The sun protection is big. Vitamin E, resveratrol, those things can be in skincare. They can also be taken as supplements to kind of protect from the breakdown of free radicals. So then you have how do we rebuild our collagen? How do you rebuild the elastin? And that is kind of a long answer, but on a simple term, things that can regenerate. Again, vitamin C can regenerate collagen. So if you have skincare products, vitamin C should be in there. Retinols, again, tretinoin, adapalene, that can because it's increasing your cell turnover, it's stimulating collagen. And that's why it works well as an anti-aging, because it's helping to firm, tighten, and plump your skin again. Hyaluronic acid, again, just supplementing with that. Niacinamide, collagen supplement, like we said, bone broths. AHAs and BHAs is a category of acids that are in a lot of stuff. A lot of our ZO stuff has it. Those acids help to chemically exfoliate, and in that process boost collagen and elastin. So having those ingredients sprinkled throughout your skincare routine or even as supplements can be really helpful. Again, a lot of our ZO stuff has that stuff in there. On a more complex, aggressive level, I would say chemical peels, things that are what we would call regenerative. Chemical peels, microneedling, lasers. Those are going to be procedural type things that break down your skin as micro injuries. And then in the reparative process, our skin massively produces hyaluronic acid, collagen, and elastin. So that wouldn't be something you do daily, but having your daily skincare routine have them in them, and then doing a regenerative procedure, a couple times a year would be great. Chemical peel, 3 chemical peels a year, Dr. Obagi from the ZO line says stops your aging in progress. So 3 chemical peels a year, microneedling, you can get them as often as monthly, but those are going to be aggressive ways of building up and producing that collagen and elastin. So that's going to be really big. The process starts in the mid-20s, but then it continues to, you lose 1% of your fat, which, in your face, we don't want fat in certain areas, but for youthful appearance, you want fat. So this is a great example of in your 30s and 40s, how your face fat pads distribute. And over the 10 years generation, the fat pads literally shrink and start moving down. So when you're, 50s and 60s, you've lost 60% of those fat pads. So these ingredients and these procedures help to replenish that. Then you have Botox and fillers. A filler is a hyaluronic acid gel, and strategically placed in an area where there is much less fat pads can help plump up to make that simulate what it looked like when you were 30s and 40s. That's a little bit of that's not helping you produce your own, but that's replacing what you've lost. So that can be used to help rebalance your face when you've started to show signs of aging. And that's just going to be, based on the person. But there are even biostimulator injections like Sculptra, where you can inject areas of fat loss that helps you produce your own collagen, elastin, and hyaluronic acid over months to years as a continuous process. So those injectables are going to be great for helping you produce your own as an anti-aging. And so I kind of say it's never too late to start. I've very recently, in the last couple of years, my cosmetic practice was mainly focused on 70 and 80-year-olds. And they're like, I've never done this, and I'm like, it's never too late to start, because it's going to depend on how much you want to spend and how aggressive you want to be. You can, again, get these procedures once a month and you're going to have results. Are you going to look like you're 20? No. I don't know that there's an actual way of stopping all aging. And that's not necessarily the goal. To me, the goal is to look age appropriate, but to look youthful and refreshed. We want to look appropriate. We don't want to look fake, but we want to be healthy. I think that's a big balance for me. And that's why I think even in men, at bare minimum, sunscreen can be pivotal in just slowing your aging process. But men are a little bit difficult to get them to comply to a skincare routine. So I think procedures is almost easier for them. Getting something 3 to 4 times a year is easier to get my husband to do than to get him to put sunscreen on every day.